Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
So next, I would like to introduce you all to Letitia Winston. She is from DC Health, and she is going to be talking about the Speak Up DC program.
Can you hear me? Good afternoon, everyone. I know the program says Camille Quander. I'm not Camille, but I am stepping in for him and telling you a little bit about DC. So, Washington, D.C. is my home, a unique, a diverse place that's not classified as a state, the nation's capital, separated into 8 wards and made up of about 694,000 residents, of which approximately 91,000 of them are school-age youth. A transient city, the home of great monuments, the big chair, fascinating museums, and a special kind of music called go-go. Ask me about that later if you want to know what it is. Washington, D.C. is eclectic, beautiful, and full of politics, history, and culture. And despite what you may have heard about them, our youth reflect the culture, the resilience, the tenacity that Washington, D.C. is known for. So why do we do this work in D.C.? Well, I'm glad you asked. Like some of your cities, my city is plagued by high rates of violence, teen pregnancy, homelessness, sexual assault, and particularly in wards 5, 7, and 8, known as East of the River or the East End. Statistics show an unfortunate increase in reported sexual assaults east of the river. And by now you're probably wondering not only why we do this work, but how in the world do we get the work done to reach such a large population of school-age children? Well, let me introduce you to our partners. Before there was a partner, there was our very own RPE team of 1. Although that one person worked with the health and sexuality education team to implement curricula and build relationships in schools, there was still a missing component. We desired a footprint in high schools and could not seem to conquer that challenge. But fortunately for DC Health, we were engaged with the perfect community-based organization through our Community Transformation Grant, Safe Routes to School program. So we knew who to call. Deeply rooted in the community and constantly involved with youth development work, Beta Omega Services, Social Services, or BOSS, was established based on their fraternity's values of service, scholarship, and leadership. BOSS has forged lasting relationships that address the capacity and implementation challenges that we experienced. Here you can meet Mr. Quentin Hudgens on the left and Fred Swan on the right, the Executive Director and Program Director for BOSS, a nonprofit organized by the Washington, D.C. alumni chapter of Iota Phi Theta fraternity. Quentin shared his appreciation for the initiation of this partnership and says that this partnership has allowed us to reach more youth in areas with greatest need and those youth who may be in the school setting or may not be in the school setting. Here you can meet Mr. Julius Hall of BOSS. He's the gentleman with the striped sweater. Julius is facilitating an all-male relationships plus class at H.D. Woodson Senior High School that's located in Ward 7. Participants share with Mr. Julius that he provided them with a comfortable space to discuss masculinity, their values, and relationships. And not only does BOSS help us facilitate these sessions, but they also mentor these young men over the course of the school year. Mr. Hudgens also shared with us that the DC Health Rape Prevention Education Program partnership has allowed them to increase their reach into the community to fulfill their mission of improving the physical, economic, and communal well-being of youth in the District of Columbia. So not only is this partnership benefiting DC Health and helping us reach our goals, but our community partner is also accomplishing their mission. Mr. Swan here is seen with a mixed gender class at Cesar Chavez Charter High School, located in Ward 5 in DC. Mr. Fred, a social worker by training, has been working with youth for over 25 years in DC. His background and experience have made him extremely effective in working with our youth that have emotional and social challenges. He told us that teachers and social workers realize this type of programming is needed and something that should be included in the regular curriculum. BOSS significantly contributes to program outcomes. For our 1st to 5th grade population, we have seen an increase in the knowledge of topic areas of abuse, bullying, and personal safety, with evidence across all age groups of a deeper understanding of violence prevention and healthy relationships. So as you can tell by now, the focus of our program is with school-aged children and youth. So schools are extremely important to the success of our program implementation. They have expressed their appreciation and satisfaction with our partnership with BOSS to increase programming and address social, emotional, physical, and mental concerns of students. Administrators have shared with us that DC RPE's program role has contributed to keeping students safe in and out of school and subsequently creating an environment where students are academically successful. Partnership has been vital to the mission of our violence prevention programming to reduce incidents of sexual assault in DC, and in my city, the nation's capital, a collaborative spirit to reach the most vulnerable of our population will continue to guide the DC Health and its partners, and it's our time to speak up. Thank you.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.